Well, those will fill the void deliciously. Ba-da-ba-ba-ba.
So from one sweet face to another, this is Anya. She's a 6-year-old miniature poodle, and her owner, or maybe the one who she owns, I don't know, is Dr. Jason Strasberg. He is with the Veterinary Care and Specialty Group, which is really kind of the home, if you will, for CTAC, right? Y'all are kind of neighbors now.
Yeah, exactly.
In this great effort to help all of our pets in the area. So good to see you.
Yeah, it's really nice to get to see you too.
So you hear veterinary care, but then the key part is in specialty groups. So within VCSG, as it's called, you have these highly trained, specifically trained specialists, of which you are one.
Yeah.
So you are a radiation oncologist,
That's
is that correct?
Yeah. So just like any human doctor that goes through additional years of training after they finish schooling, that exists in the veterinary world to a little bit of a lesser degree. And VCSG is just like an Erlanger or anything like that. Obviously to some degree, but we have neurology, oncology, surgery, and all of these different types of specialties. So we go through training after our veterinary school for that.
So in our conversation before you came in with Dr. Suter, he was explaining how with the stem cell work that y'all are now able to do over at CTAC, first thing first is to go through the chemo and the radiation. So in the specific cases of dogs like that, would that be you?
Yeah, so I'm definitely play a very helpful part of that. I don't know the exact details that Dr. Suter went into, but you're exactly correct in the sense that they get chemotherapy to kind of get them hopefully into remission. But there's always some amount of lingering cells, right? Chemotherapy for canine cancer, or specifically lymphoma, doesn't usually cure. And so there's always either some kind of lingering cell, and so that's what the radiation tries to do, is essentially wipe out anything that's still there, so that when they transplant those stem cells, they have a chance for an actual cure.
Okay. Is the work that you do in your radiation oncology specific then to the lymphoma and the leukemia, or are you able to treat other types of cancers?
Yeah, I mean, that's a great question. And honestly, I don't treat lymphoma and leukemia very often.
Okay.
It's almost exclusively in this kind of setting, and there's a couple of other settings as well. But I more commonly treat essentially non-surgical types of tumors. So tumors that either you can't access surgically, like the brain or the inside of the nose, prostate, things like that, or they're so big that there's just not enough room to close, skin to skin, and things. So those are kind of the tumors that I would say I treat most often.
So when people come to your door, typically it's not their best day.
Yeah.
And anytime you're going through a struggle like this with a family member who you adore and would do anything for, your thoughts aren't flowing properly.
Absolutely.
Your cortisol's strong.
Yeah.
So do you try really hard to kind of give the families coming to you as best of a guide as possible?
I mean, that's my job. That's part of the reason I wanted to do this is, people hear the word cancer and they obviously think to the worst, and you think with your brain until it's your pet, and then then you kind of get lost in everything. And so it's my job to kind of guide owners through that situation, and most of the times I can provide encouragement. A lot of times there are options and can provide years of control, and sometimes there's not. But that's kind of what I like to do, is give people those options.
Are there some things that we should know about ways to prevent this in our pets? No, there's no prevention of cancer, but are there some things we should try to at least be mindful of?
We're learning more about that. There are some things that we know. For instance, it's no secret that smoking causes cancer, lung cancer in people, right? So same kind of thing, secondhand smoke can cause or predispose certain dogs to cancer. There are certain pesticides or certain lawn care ingredients and things like that that has been proven to increase certain risks of cancer. But there's just a lot that we don't know.
Right. Does the food that a dog eats play into anything?
Potentially, but we just don't know. We're actually kind of looking more into that, and there's people that are trying to make cancer-specific foods to help fight cancer too. So, we're a little bit behind the human world. So we are trying, and there are people into looking into that, but we don't know that 100%.
How many types of cancers are there for a dog?
Oh man, honestly, hundreds.
Really?
There's what we call blanket or umbrella terms like carcinoma or sarcoma, and then there are subtypes, and for people there are hundreds of subtypes. But there's a lot.
So let's say that someone brings their pet to you. Again, I think this begins with seeing your primary veterinarian first, and a referral is required.
Yeah, exactly. We're usually what we call a secondary or tertiary referral, meaning that either they get referred to somebody, and then they refer to us or directly from your primary vet.
So is a lot of the work that you do at VCSG really like you talking with the family and kind of feeling the pet and going over everything with them to see what their findings have been as well as your own?
Yeah, so I'll take all the information from a primary care veterinarian, and occasionally, depending on my relationship with them, I'll talk to them on the phone about it. And then when I see, that patient, I'll talk to the owners, I'll talk to them about the information I know, I'll do, obviously my own exam, and we'll kind of go over options and next steps.
While a dog is going through the radiation, are they going home?
Most of the time, yeah. The only times that's not the case is if they're truly very sick, which is very rare, or sometimes I have clients from very far away. We are the only operating radiation oncology unit in Tennessee. Nashville will be here, I think, in the next couple months. But that just kind of speaks to how few and far between there are. So we see people from all over the place.
So are you saying that if somebody today is watching and their pet was just diagnosed with cancer, the dog could possibly come to you for radiation only or the chemo as well?
So both.
Okay.
If certain cancers, chemotherapy isn't very responsive, or vice versa, right? But we have the ability to do both, and I work very closely with medical oncologists that work at VCSG, and so that's the difference is medical oncology versus radiation oncology, chemotherapy versus radiation therapy.
It's that team.
Yeah, so we work together on all sorts of cases, because it can be beneficial.
And is it dogs only, or are cats benefited by
Dogs, cats, occasionally we've treated some exotics, and some kind of rabbits, birds, and things like that. But I would say primarily dogs and cats.
Well, it's great to know that there is hope for people. I've lived that myself, and it's a very heartbreaking time. So that's good that you're able to provide that hope for folks. Here's where you will find him. His name, Dr. Jason Strasberg. He is part of the team there at VCSG. The website, vcsgvets.com, and there is their phone number. Aren't we lucky to have them in our own backyard? Thank you.
Yeah, thanks.
Most homeowners have it somewhere in their house. It's that one bad window. It's drafty, or maybe it sticks or leaks. Bottom line, you'd love to replace it, but think no company is